that end, Secretary Cheryl Strange and I are urging compliance with the following in nursing homes and assisted living facilities, and these will be requirements. Number one, we are requiring compliance that residents are limited to one visitor per day. Visitors must be adults, and the visit must take place in the resident's room. This does not apply to end-of-life situations. Number two, all visitors must follow COVID-19 screening and follow reasonable precautionary measures. Precautionary measures might include, but are not limited to, wearing personal protective equipment, social distancing, or visiting in designated locations. Number three, all visitors must sign into the visitor's log, and owners and operators must retain that log for 30 days. Number four, employers or volunteers must be screened, it's not testing, but screened for COVID-19 symptoms at the start of each shift. Number five, people living in nursing homes or assisted living facilities who are under a recommendation or order of isolation or quarantine from the Department of Health or local health department must be isolated in their rooms away from other people. Number six, owners, operators, staff, and volunteers are prohibited from disclosing protected and confidential health information, except as otherwise provided by law or with the consent of the resident. We are doing this to protect our patients, obviously, their families, and people who care for them. These additional rules are designed to provide a backstop for the vast majority of workers who do not have access to employer-sponsored paid leave. And they will help relieve the burden of temporary layoffs, isolation, or quarantine by ensuring unemployment benefits are available to individuals whose employment has been impacted by COVID-19. These new rules will ensure the following. Workers will be able to receive unemployment benefits, and employers will get relief of benefit charges if an employer needs to curtail their business or temporarily shut down operations due to these problems, or because a worker becomes sick and other workers need to be isolated or quarantined as a result of the virus. If a worker falls seriously ill and is forced to quit, they may qualify for the paid family medical leave while ill under the existing program. Once recovered and available for work, they may apply for unemployment benefits. Next, we're providing leniency to businesses and individuals affected by COVID in their timeliness for financial penalties for late payments and information that is due. We're also allowing businesses using standby to include their part-time and less than full-time workers. I want to address our state employees. I'm also announcing steps today that will help those who work for the state and are impacted by COVID-19, including expansion of leave and telework options to all state employees. Franklin may have answer any questions you have specifically, but I'll go through this quickly. This morning I sent a letter to our state employees and I laid out these additional options. First, telework. State organizations will explore all possible options to expand telework to employees impacted by COVID-19. Next, we're expanding leave. State employees impacted by COVID-19 and required to self-quarantine or isolate under CDC guidelines will be permitted to stay home and pay if they're unable to telework for up to 14 days. Next, guidance around staying home and self-isolating. I will continue to ask state human resources to continue to monitor instances where our leave programs can support our employees and our families. I'm going to summarize what our state has been able to find. We have 162 presumed people whose test results have shown that they have the virus in Washington State. But unfortunately, since we haven't tested 7 million Washingtonians, we know that there are many, many other people today in Washington State who have the virus, who have not been diagnosed and may have no idea, may have no symptoms at this moment. And there is a range of that number, but the number I use is about 1,000, and it could be a lot more than that, frankly. Here's the problem and our mission. We need to look forward ahead of the curve in Washington State. If we're going to stop this epidemic or seriously slow it down, we need to look at what's coming in Washington State, not just as what is here today. Now, if we assume that there's 1,000 or more people who have the virus today, what the experts are telling us is that in an epidemic like this, looking at the characteristics of this virus, the number of people who are infected will double anywhere from 5 to 8 days. So the number of people who are infected in an epidemic like this will double in the state of Washington unless we take some real action here. And if you do the math, it gets very disturbing. When something doubles every day, it gets to a very large number very quickly. So if there are 1,000 people infected today, in 7 or 8 weeks, there could be 64,000 people infected in the state of Washington if we don't somehow slow down this epidemic. And the next week, it'd be 120,000, and the next week, it'd be 250,000. So this demonstrates why we have to consider all of us in our family activity, our individual activity, our institutions, that we need to take action today looking forward, and that's what we are doing.